go ahead and submit your questions in the chat. With that, I welcome Dr. Vyas.
Hello. Yes, so thank you for the introduction, Raginji, and we'll start today with the topic neck pain. I know everybody must be watching exhausted relaxation since 2 3 days, and looking at the TV can strain your neck too. So this is a perfect time. So we'll go over neck pain and how to avoid, how to do the prevention, and the topics that we're going to cover today. If you can put the slides, that I can. Yep. So this is the first. Do the next one. So today's agenda is I'll try to cover the basic questions that have been asked, and there are many confusions among the patients that what should I do? So first I'm going to talk about the prevention. You don't want to wait till your neck is hurting. You want to start implementing all the precautions, postural training before it happens. And I'll tell you why. There are so many data that suggest that you should be doing prevention rather than waiting for neck the pain to happen. The second, we'll talk about the causes, that what causes neck pain, like what kind of things you should be avoiding. The third thing I'm going to include is a self-assessment that I try to keep very simple so you can do it at home. I'll explain in detail how to do it, what you should be careful while you're doing it, so you can get some ideas about what you can do for that. Modify behavior. So from this onward, it's very, very interesting because daily habits is biggest thing, because it's not going to happen overnight. You have to make some changes in your routine, in your daily life, to see the results. Questions like inversion table, what kind of pillow, those are the things that I've included in the presentation so you can understand. So at the end of the presentation, you should be able to tell that what kind of pillow is right for you, or inversion table good for you or not. So that will definitely, your computer desk, because most of the people are working from home right now. Exercise to improve your posture, because many times by working on the computer, people get like a humpback. So we'll talk about that. Stretch to reduce the stiffness. I hear a lot of time with the pain that in the morning when I wake up or at the end of the day, my neck is very stiff. So we'll talk about some of the stretch. All right, so first we're gonna start talking, we can do the next one. So we'll talk about the prevention. So the prevention, why prevention is better than cure. So the reason is because the neck pain is the top 5 disorder in the USA. There are 10 to 20 population affected by the neck pain. So this is more than it's very severe condition that affects people and make them even disabled in the long run. It's just we don't bother because in a routine life, until something stops us, we don't stop. Until the neck pain radiate down to your arm, you think, okay, it will get better by itself. So we just ignore that. 30% of the neck pain turn into chronic pain. The chronic pain means that it just stays there and there. At long term, it doesn't get better in 2 or 3 months, and it just stays there. 25% of the neck pain becomes recurrent pain within the year. So what it means is that, let's say you got a neck pain today, you did something, you watched some YouTube video, you got better, but then you don't follow the habits, postural awareness, and the next year you get it again. I get many times patients who says I had a pain last year, I did some exercise from the YouTube or Google, and it got better, but this time I try to do the same thing, it didn't work. So that's very common. Office workers, manual laborer, and healthcare workers are at the risk because those busy people don't think about the precautions while they're working on their work, at the job. So those are the most at the risk. Less than 20% young adult knows about the term text neck, because that text neck is a real term now. One of the chiropractor in 2018 started using this text neck, and that becomes very obvious now, because most of the time we are stick with our phone. We look down all the time. That's called text neck. You're looking at the phone, your smartphone, and your head is down all the time. If you wanted to track, you can check your screen time. There is an app, there is so many things you can do on your smartphone, so you can keep the tracker, the screen time. So let's say in a day, 2 or 3 hours screen time, that means 2 or 3 hours you were looking down. And you'll be surprised by the data. You'll be surprised by the time that, oh, really, I'm spending this much time just looking down. Okay, so you can check that. Okay, so in the resting, when I'm sitting right now, the weight of my head is about 10 to 12 pounds. But that weight increase when I'm looking down. So imagine, like, if I'm using the phone 2-3 hours a day, and if this is the phone and I'm just looking it down 2-3 hours, so that 10 to 12 pound weight becomes 60 pound for 2 to 3 hours. So you can imagine, what happened to the vertebra and the disc. Okay, and then after, I hear, many times, 60-year-old patient comes in and they said, it was fine, it just happened yesterday. And I said, no, it didn't happen yesterday. It was building up, but now you're showing the symptoms. Okay. All right, we're going to do the next one. So here I'm going to explain a little bit about the anatomy. What is cervical spine? What is neck pain? So if you look at the cervical spine, it's curved. So that's called the normal lordotic curvature. It's very important. Remember this term down the time, later in the time, I'm explaining why it's very important. So in the cervical, we have 7 vertebrae. Overall, in the spine, we have a cervical, thoracic, lumbar, sacrum, coccyx. Those are the spine. So 7 is the cervical vertebra. 7 numbers are there. Possible movement in the cervical spine is flexion, which is bending forward, extension, which is looking up. Okay, so the side bending is like going side to side, and rotation is just looking this way. Okay, all right, so the lordotic curvature means that curve that you see on the spine that we need to maintain. Anytime our body, it's called normal anatomical position. As long as you maintain your normal anatomical position, your body will not react. Okay, and to use the pillow, I'll talk about this when we go on that slide. Okay, we'll do the next one. So this one, let me explain a little bit about. Now we're going to talk about the cause, that what causes the pain. There, you must have heard many times different terms like herniation, bulging, disc injury, spondylosis, stenosis. So here, the fibers that you're looking outer side, the kind of orange color, that's the annulus. That's a strong fiber, and there is in the center there's a nucleus, which is like a jelly-like substance. So what happened whenever there is an injury, repeated movement, something like that, it push on your nerve. So the yellow band-like appearance you see, that's the nerve. Now, when you see the professional people like physical therapists or orthopedic doctor, they ask you the symptoms. So it's very important that you explain it to them, what you're feeling, how you're feeling, since how long you've been feeling, because this is called dermatome. The dermatome means based on your symptoms. Let's say you tell me that, okay, my numbness or tingling is only in the 2 fingers, the last 2 fingers right here, and it goes down like this. So based on that, we can understand what level of the cervical spine is affected even before further investigation like X-ray or like MRI. Because that's called dermatome, because we know exactly which level supplies where. So based on your symptoms, we can understand what level might have been affected. So we'll go in that way. So make sure that you explain in detail your medical history, your symptoms, how long you've been having this problem, so we can do further better treatment. Okay. All right, we're going to do next one. So next one, we're going to explain the symptoms. So if you have this one, we're going to talk about the disc injuries. If you have any disc injury, like herniation, bulging, rupture, so what kind of symptoms you might experience? So pain in the head. The headache sometimes is associated with your neck. It's totally separate topic. The headache, it could be cervicogenic, means your cervical spine is involved. It could be musculogenic, which means your muscles are tight and you're getting a headache. They're the whole different topic for that one. But the headache can be because of your neck problem. Radiating pain down to your arm. So whenever you have any impingement in your nerve, you may experience some radiating symptoms. Pain is more in morning at the end of the day. So in the morning, most of the time you experience it because when you're sleeping, your position is not right. So you get the pain in the morning. At the end of the day, because you've been working like at your work, you're not following the posture, so you may get it at the end of the day as well. It also increases with the walking, standing a long time, so it does increase with that, or looking down. You get very limited range in your neck, and many times with this kind of injury you get the spasm. So what happens is called trigger points. You build up lactic acid on the fascia of the muscle, so you know that you feel the knot, and you know if you go for a massage they say, oh, you got a lots of knot, you got lots of trigger points. So that developed because what happened, our body is meant to move, so our neck should be keep on moving it, or up and down and like that. But when you don't use those muscles because of the pain, what we'll do is you will start using the that movement. So for example, if I'm turning this way and if my neck is hurting, so what I'll do is instead of turning my head, I'm just going to turn this way, the whole body. So you're not using the muscle it's supposed to use. So what happened, that muscle start tightening up on you, and because of that you build up the knot, and that knot is right on the fascia and the muscle. There is a space in between that, you build up some lactic acid, and that's the trigger point that gives you pain whenever you're trying to move it, and then that's why you feel all the tightness. All right, okay, so we're going to do the next one. So this is the causes of the injury, like that as I mentioned, the disc injury can be because of the herniation, bulging, rupture, irritation to the common disc injuries. It's very common after the 40 year and older population are more common. Very common in heavy lifting job, if you're working in a warehouse where you have to repeatedly lift something, or also it happens because of the repeated movement. So some job require repeated movement, the same movement you got to do it over and over, so that does cause the problem with the disc. So as I mentioned in the previous slide, it's a annulus and the nucleus. That's are the component of the slide in the photo. Okay, so that's here you see the annulus and nucleus. So those are the things that we mentioned in the causes. So that the rupture happens in the disc. All right, we'll get back to the slide. All right, okay, so we'll do the next one now. So now we're going to talk about the cervical spondylosis. So cervical spondylosis, basically you can say that means it's arthritis in the spine. So you get lots of wear and tear in this photo, that these bone, the vertebra is having a lots of wear and tear, and because of that it interferes with your disc, it interferes with your movement, it interferes with your activity. Okay, we'll do the next one. So this is just normal wear and tear, as I explained, and it can be asymptomatic. So many times after a certain age, like 40 or 50-year-old or more than that, they have a spondylosis, but it's asymptomatic. It doesn't cause any problem. So then in that case, you just need to follow up with the routine and you should be okay. There's no problem. The dehydrated disc, that's very important, because one of the cause of this spondylosis, it could be dehydrated disc. We don't drink enough water. Our disc needs some water too. So when you drink water, the part of the water does go in your disc, because if you don't hydrate your disc, it will dry up, and that will cause those problems too. And same with the bony growth, bone spur can develop too, because with the arthritis, there's lots of wear and tear. There's friction happen. Because of the frictions, the small bone particles either grow, or that's called the bone spur. So that can interfere with your movement. Okay, we'll do the next one. All right, so symptoms of the spondylosis is pain and stiffness on the neck. The stiffness is more with this spondylosis versus disc injury, because your vertebrae are involved. So that's why the stiffness is more. Very limited range in the spine. It can get the pinched nerve because of the bone spur. That spur, the bone particle, can compress on your nerve. And because of that compression, it can cause the symptoms like a radiating pain, tingling, numbness in your hand. The headache is also common, because whenever the spine is involved, it can lead to, if it's a higher level, it can lead to the headache. A grinding feeling, because of the, as I say, bone spur, you may feel some grinding. When you're trying to turn your head or look up, you feel like kind of grinding movement. And muscle spasm, as I explained earlier. Okay, we'll do the next one. So cervical stenosis. So this is also very common. I hear a lot of time, and patients are very confused about this spondylosis, stenosis, and the other disc injuries. So the stenosis means narrowing of the lumen, like of the spinal cord. So the spinal cord goes in foramen, and if that foramen start narrowing, that's called stenosis. If you see that band-like appearance, the white band-like appearance right in front of the nerve, that's the posterior longitudinal ligament. Okay, we'll do the next one. So that posterior longitudinal ligament caused the pressure on the spinal cord with the extension when you look up, and that increased the narrowing of the spine, okay, in the condition like a stenosis. So many times people don't have like understanding that with the stenosis, you wanted to try to avoid hyperextension. So the reason is because when you're doing the hyperextension, that posterior longitudinal ligament kind of flap, it bend, and when it bend, it narrows more. So if you already have a stenosis, and if you're trying to look up, that will cause more symptoms. So with the stenosis, you wanted to try to avoid that extension. Okay, let's get back to the slide. And mostly it affects the people more than 50-year-old. Okay, and the symptoms of the stenosis can be like this one. In severe cases, it can affect your bowel and bladder dysfunction. It can really affect that one. So if that happened, definitely you wanted to seek the doctor. Weakness, tingling, numbness can be a symptoms as well. And it can affect your motor skills like buttoning or writing, because you start getting the weakness in your hands. It's called the myelopathy, myeloma. So basically what happened that it affects your nerve, and when that affects your nerve, it start getting more symptoms in the hand, and you start getting weakness. Okay, so that's the stenosis. We'll do the next one. So now tips to reduce the pain. So all these conditions that we discussed, so what you should do to make sure that you don't get a pain in that kind of situation. So let's say you already got the condition. What you need to do is to avoid repeated neck movement and heavy lifting. So you have to make some modification in your lifestyle. If you're having occupation where you require some heavy lifting or repeated movement, you have to find some modification to do the job without causing any neck pain. There are like, you can definitely consult with a physical therapist or doctor, and they can talk with you about like, what kind of modification you can do. There are so many things available in the market that you can discuss with their professional people, and they can tell you how the modification can be done at your work. That's the occupational thing that we can definitely help you with that one. Okay, let's get back to the slide. Okay, so let's get back to that one more. The symptom, the tips. Okay, all right. So the healthy posture habit is one of them. It's very important that you follow the proper posture, because that's the biggest thing. Many times, like at home, at work, people don't follow the posture, and then they end up with the pain. Regular stretching and strengthening is very important. Your muscle has to move, your muscle has to stretch, and muscle has to strengthen. Then only you're gonna be able to maintain your cervical positioning, and you won't get any kind of wear and tear. Ice for the inflammation and heat for the muscle spasm. Uh, this question I've been asked many times: should I use the ice or heat? Now there is inflammation. If you have active pain and you right in the center, you wanted to use the ice, because that means you have an inflammation. If you're having a symptoms, radiating pain, that means you have a symptoms. If that happened, that's they call inflammation. And inflammation, if you put the heat on the inflammation, it's increase the inflammation, because inflammation means lots of blood circulation is already happening, and if you put the heat, that will increase your circulation more. You don't want that, so you want to put the ice to reduce the inflammation. But because of this the cervical condition, if you got a spasm, then you can put the heat on the spasm, because the tight muscles, if you put the heat, it will relax the muscle. So that you can do it on the muscle, but not on the spine. Spine, you wanted to use the ice. Okay, let's get back. And pillow, very important that you have a right pillow. You're sleeping 7-8 hours a night, and during that time, if your neck is hyperextended or hyperflex, or if it's not positioned properly, your muscles are in that position for almost 7-8 hours. That is not good. That means in the morning, definitely you will have a problem. So that's very important that you have a right pillow. We'll talk about that a little bit later on. Let's do the next one. Okay, so this is the self-assessment that once you got a neck pain, I try to include very basic tests that you can do it because there are so many advanced tests that, but you don't want to do that. If you come to that situation, you wanted to see some professional people. You don't want to do it by yourself because I know many times people try to do something, and if you don't do it right, then you will just say, okay, either I have a lots of problem or I don't have a problem. So that's why I try to include very basic one. So the first one is a neck flexor endurance test. Why do I need a neck flexor endurance test? Let's do the next one. So this one is the neck flexor endurance test. So we wanted to check the strength in your neck flexor. Neck flexor means there is a muscles deep inside the throat which helps to bend your neck, okay, so which is deep inside. That is very important to maintain your posture. If you don't have a strength in this muscle, there are likely that your neck is going to be in not right position. So that's why to check the endurance, that how strong is your muscle, we do this test. So for this test, as you see, you lay down on the table and you're going to do chin tuck. Okay, so you're not simply lifting your head up, you're kind of your chin, you're going towards the chest. Okay, let's do the next one. The next one is the steps. Okay, so the chin tuck position, as long as you can hold it. So you lay down flat on the bed, you lift your head up and do the timer. Turn on the timer, do the phone or whatever the timer you have. Start the timer and you stay in that position. Record how long you can hold that position. Okay, so the mean score for this test is the man should be able to hold for 39 seconds. Women should be able to hold for 29 seconds or more. The positive test is if you're unable to maintain the position for that long time. So if the man cannot hold for 39 seconds or women cannot hold for 29 seconds, that's a positive test. That means your neck flexor muscles are not that strong. You need to work on that one then. Okay, all right, we'll do the next one. So the next one is a self-distraction test. That is very important test if you have a radiating pain. Sometimes you get the pain in the shoulder, in your arm, in your forearm. So this test help to identify whether your neural structures are involved or not. So what do you do in this position? You make a fist below the chin. Don't push too hard. You don't want to push your trachea. This one is just for the support. You're not pushing it anything. You're pushing it from the back side. If you look in the picture, you hold the hand right on the occipital. Occipital means like, your skull, the base of the skull. So you keep here, no pressure at all in the front. Okay. Make sure you follow the instruction because this one is very important, that you just put the hand and you lift the head up from the back for about 30 seconds or whatever you can tolerate. If your symptoms relieves, let's say you have a pain in your arms or shoulders, when you do this, if the symptom relieves, that's a positive test. That means your nerve were compromised, but when you do the traction, it released the pressure because you lift your spine up, you lift your vertebra up, so it released the symptoms. So that's a positive. That means that your neural structures are involved. It's negative if there is no change in your symptoms. Okay, all right, we'll do the next one. So this one, you don't need to read all those things. This is a questionnaire. This one is used by many, it's a very standardized questionnaire used by many insurance companies like Cigna, United Health. So many payers use this one. And also the doctor's office and like can decide based on this form questionnaire, can decide how disabled you are because of your neck pain. So there's 10 questionnaires. So if you notice, there are 6 on this one and there is a 4 on the second slide. So pain intensity, personal care, reading, headache, concentration, lifting. Okay, let's do the next one. Okay, work, driving, sleeping, and recreational. There are 6 boxes. The first one, if you answer first, that's a 0 score. If you answer 6, like the 6 box, that's a 5. There are possible 50 score on this one. So let's say you answered like all of them. Let's do the next slide. So this is the interpretation of the score, the questionnaire. So let's say you score all the question. You fall on 0 to 4. That means there is no disability. If you have a question total 5 to 14, you have some mild disability. 15 to 24 moderate, 25 to 34 severe, and above 34 is complete. That means like your neck is so bad you cannot functional normally. So based on this we can decide how disabled you are based on the score or the questionnaire, because this questionnaire filled out by the patient, so it's more subjective. So you tell in the form that exactly what you're experiencing. Okay, let's do the next. All right, so now all the slides are very interesting based on like daily tips. So as you notice, this is like how texting could affect or damage your spine. As I was talking about in the beginning, that if you're just standing straight, look at the first photo, the man with the red t-shirt holding a phone. The weight of the head is 10 to 12 pounds at that position. As you start leaning forward, as you start looking down your text neck, you're looking at the phone, the pressure goes to 60 pounds. So what do you need to do? Look at like the second photo. When you look at the phone, and that's how we do it all the time. I haven't seen anybody like looking a little bit like that. That's the habit that you have to adapt. But look at that: the tension headache, the neck and shoulder pain, difficulty breathing, pain in the middle back, chest and lower back. There are so many complications that can happen over the time because our body is not meant for that kind of position. It has to be neutral, as I said about the anatomical position. So you wanted to make sure you adapt or change behavior like that. Okay. All right, we'll do the next one. Now, bag lifting technique. Mainly the women, they hold their purse and they put so many things in that. It's so heavy. Don't want to do that. You don't want to carry, if you're gonna hold something long, like very heavy, don't want to carry it on the shoulder. Okay, backpack is the best thing if you're gonna carry a lot of weight. In your routine life, you should not have a lot of things in your purse. The basic need, you can have it in a purse. Look at the first picture. I bet some, like once in your lifetime you must have juggle like that, like trying to get some bags and like take care of the kids, and definitely that affects your posture. But the next photo is the wrong posture too. If you're lifting some bag, obviously you're going to lean on the other side to compensate the weight, so that is not good. So definitely that weight is not good. So you wanted to hold with the both hand then to maintain the posture. The third photo is the right position for the back technique. So if you're having the purse, the cross holding is the best position because the weight is distributed throughout the spine. So in that way, you don't get the pressure on your only one side of the body. Okay. All right, we'll do the next one. All right, this is working from home tips. Right now, I know because of the pandemic, most of the people are working from the home. So I wanted to make sure that I give you some tips to make sure what modification you need to do. Environmental setting. You got to make sure that where you're sitting, where you're spending, this is your office now. When you're working from home, that's your office. You have to make some modification. Make sure that there is enough space surrounding where you can stand up and stretch yourself. Ergonomic chair, lumbar support, neck support, very important. Remember I told you about that lordotic curvature in your spine. So your lumbar support or neck support has to, so lumbar and cervical spine has a normal lordotic posture. So you wanted to give support, put the pillow or something to maintain that posture. Okay, so your chair should be that it supports your neck and your lumbar. Computer station eye level, it has to be at like normal eye level. You don't want to do two down, you don't want to do two up. Okay. Keyboard and mouse setting, your keyboard and mouse has to be neutral, that your elbow is 90-degree flex, so it's not up, it's not too low, because if it's too low you're gonna lean forward. If it's too high, your shoulder will be up like that. In the next slide we're gonna show you how the posture should be. The footrest. Okay, let's do the next one. So here you see like the eyesight. The first of all, the computer should be high, so you're not looking down, you're looking straight. Look at the position of the keyboard. So the shoulder and arm is really neutral position. The first photo, you will see like it's extended. That's not good. That does affect your shoulder or cervical. So you want to keep it neutral. Look at the back support. So it's properly, the lumbar is properly supported in this chair for sure, which is good. Now the height of the chair. So if the person is short, if the chair cannot adjust too much, get the stool. So your leg, your hip and knee has to be kind of a 90-degree. So you don't want to slant it in the chair. You don't want to slide. You want to maintain that position. Okay. All right, let's do the next one. Okay, so the workstation stretching. It's very important that you stretch every couple of hours. Okay, so 2 to 3 hours, you want to stretch yourself. The stretching that I explained here in the photos are very basic one. Okay, so the first one, you stand up from the workstation, you hold a chair or a counter if you have a counter, and just stretch yourself like straight. What you're doing right now, you're pulling your shoulders and your neck and your back, you're stretching in that position. The second one is you're holding the door. You don't need to put the leg on the chair. You can just keep it down, but just hold the door and just go on the sideway. So you can stretch on the side. The third one is your rotation, the neck rotation. So you want to just gently just turn and hold it. Okay. The fourth one is the thoracic extension. So you wanted to make sure you hold it like this and you stretch it like that. Make sure your chair is not, it's properly supported. You don't want to fall back. So you have to be a little bit sturdy chair for that. Okay. The third one is chin tuck. So basically you're gonna do like that. And the sixth one is side stretch. So you're just stretching on the side. So let's say you do 20 seconds of each position. It will take you only 2 minutes. Okay. So the 20 second, six stretch, 2 minutes. So 2 minutes can save your too precious neck. Okay. So put the alarm in your phone every 2 hours or 3 hours. Do this 2 minutes. Spend 2 minutes for your neck. Okay. The next one. All right, the bonus tip. Follow 20-20-20 rules. Okay, so the look 20 feet away for 20 seconds every 20 minutes. You won't believe there is an app for it. Okay, so they 20-20-20 rules, there is an app. So you download that, you literally Google it, 20-20-20 rule app. You can download the app and set all you got to do is just log in. It will remind you every 20 minutes to look up and look 20 feet away. It will the alarm will go off, which is good because you want that. So just a tip, make sure the cold, this is very important, many people don't know this one, to make sure the cold air from the air vent is not coming on your neck. When you're sleeping on your bed, we have sometimes the air vent on the bed, like above the bed. Okay, so when you're sleeping and if the cold air is mainly in these the summertime, if the cold air is coming on your neck throughout the night, the cold will make your neck stiff. So in the morning, when you wake up, you are gonna feel stiff. So look for the position, vent. And if it's coming like that, you got to change your position then. Stretch your neck regularly. Of course, you want to make sure, as we discussed about the stretching, drink enough water. As we discussed earlier about the disc, that you got to make sure your disc is hydrated. Avoid sudden movement. This is big too, because many time you know that when you're trying to turn and you catch the muscle and you hold the neck for 2 days. Okay, I don't know what I did, it's just got really stiff. If you're not doing regular exercise and then you do quick movement, muscle will go in spasm. Get regular massage, dry needle, and acupuncture is very, very efficient. There are so many surveys, so many research out there that helps, that suggests that the dry needling or acupuncture really helps to reduce the spasm and all. Reduce the stress and do regular meditation. That's because whenever you stressed out, knowing or unknowingly, you just clench like that, and that does affect your neck as well. Meditation really relax your muscles too. Let's do the next one. Okay, so many times I've been asked, inversion table, is it good for me or not? So it's good for herniated disc, bulge disc, stiffness. It's good, no problem. But it's not good for the spasm. If your muscles are tight already, if you're gonna do, because see, the concept is when you do the inversion table, you get some traction in your neck, in your lumbar. Whenever you get some traction, your muscle will think that spine is vulnerable, tighten up to protect it. Okay, and that's how you get the spasm. So if you already have a tightness, you feel lots of tightness in your neck, you don't want to do that. If you have osteoporosis, you don't want to do that. If your bone is weak and if you're trying to pull it, that's not good. Or any fracture, many times there are hairline crack associated with the vertebra. If you have that condition, you don't want to do the inversion table. Okay, all right, let's do the next one. Okay, pillow. This is very, very important that pillow type depend on your habit. So many times I've been asked, okay, what kind of pillow should I use? There is one, it can one size fit shoes fit all? then why pillow? Because everybody is different, everybody's size is different, everybody's neck is different, everybody's habit is different. Like there are so many factors, like are you a side sleeper versus back sleeper, are you firm, do you have a firm mattress versus soft mattress? So what kind of habit you have, based on that you have to decide. If you look at the first picture, you will see the neck is supported, the curvature that we seen in the first slide, that curvature has to be maintained. Okay, so with this kind of pillow, your cervical spine curvature is maintained and your head is rested. So if you have a flat pillow, your head will be like a little bit elevated. You don't want that. Now, if you notice, this pillow is a little bit smaller because this person is a back sleeper. But if you're sleeping on the side, so you have to feel the gap between the head and the shoulder. So that thickness has to be maintained. You look at the spine, it has to be aligned. If your pillow is too thin, you're gonna be like bending on the side. If it's too high, you're gonna be lifting your head up. So it's very important that you do that. If you're a side sleeper, definitely you want to keep the pillow between the leg to maintain your spine. If you're back sleeper, still I would suggest to put the pillow below your knee to maintain your lumbar curvature. There are custom pillows out there. The one is the pillow wise, we also have it. So those kind of pillows are only available in the doctor's office or clinic. They measure your neck, they measure they get your habits, that what kind of habits you have, and based on that they will suggest you what different size pillow should be good for you. Okay, so it's very important that you follow this one. All right, we'll do the next one. The soft collar. This is also many times I've been asked that my neck is hurting, mainly like if someone with this spondylosis or disc problem, they said, should I wear the collar and go for a walk or something, like should I wear a collar during the different activity? You can do that if your pain is acute. Acute means like if you actively have severe pain going on for a short time when you're going for a walk, you can wear it to protect it, but you don't want to do it for a long term, because when you start using it for a long term, you're guarding your muscle, you're not using your muscle, because your collar will guard your muscles, and that's not good. As I explained before, every muscle has to be used. If you don't use it, you're going to get the spasm and weakness. Okay, so that's very important. Let's do the next one. Okay, the exercise for the humpback. It's also called the kyphosis posture. Many people have the posture like that. So what you should do, so if you look in the photo, the posture, the spine is kind of going forward. That's called the kyphotic posture. Okay, so you wanted to start, these are the three basic exercise, the stretch I mentioned. So photo on the left side, the center is the hold the door and just pull it. Okay, so your serratus anterior and those muscles will get pulled. Pectoralis stretching, you just go hold the door and just stretch the pectoralis. Let's do the next one. So this one is I really like this one because I myself do this one. So if you look at the first picture, it's a before and after. So the first position, get the foam roller. If you don't have a foam roller, you can use the pillow, that's fine. But I would suggest to invest in a foam roller. That really helps in the long term, not only in the back, to many different muscles. So what you're doing is bend your leg, and then your foam roller has to be right on the thoracic or lower cervical or upper thoracic spine, and you're extending it. So it really stretch your upper thoracic. The second one in the photo, you will see, it's also called the YWL position. So you're laying on the pillow, on the foam roller, and then you're just opening your hands. Okay. The third one is the chair one. I really like that too. You can do it in the standing too. The kitchen sink, when you stand in the kitchen sink, but do make sure that your back is properly curved or supported when you're doing from the in the standing position. So you hold the head on the sink, or you can do it like on the chair. And then just pull it, and then you curve like a cat and camel exercise. You curve your upper thoracic down and up. Okay, and the last one on the right side you see is for the rhomboids. It helps your rhomboids and the lower trapezius. You put your hands on the back and trying to lift it up and down. Let's do the next one. All right, so now I'm going to talk about a little bit stretching. So those are for this posture. The exercise that we just explained is more for the posture. Let's do the next one. So this one is the upper trapezius stretch. Okay, so this also you can do it while you're sitting down on your computer. Okay, so basically what you're doing is you sit down, you turn your head up and side. Okay, And then your hand, that look at the photo, that he's holding the table and he's pulling down, because you got to make sure your shoulder is down. Then only you're gonna feel in your trapezius, and then you pull with your hand and you hold it. Okay, any stretching you should hold for at least 25 seconds. Okay, and then relax. Okay, all right, let's do it on the both side. Let's do the next one. This one is a thoracic extension that we discussed, like, I showed in one of the photo in the posture, where you want to make sure your chair is smaller. Like, the backrest has to be at the thoracic level. If it's a high back chair, it's not going to work. So you want to get some sturdy chair, make sure you sit properly, your back is against the chair, and then you're kind of going extension from the thoracic. Okay, all right, let's do the next one. This one is the upper thoracic stretch, and also it helps you with your rhomboids. Okay, so rhomboids is the muscle between your scapula, your shoulder blade. Okay, so in this one, basically you're holding your hand, you're pulling it forward, okay, and then you look down and lift it up, and you hold for about 25 seconds. Let's do the next. Passive cervical retraction. This really helps you to improve your glide in your cervical spine. So you got to make sure you put the roll towel. Should not be too high, should not be too low. It has to be enough big to support your cervical spine. And then you're doing the chin tuck like that in the laying down position. Okay, let's do the next. Okay, next. Now we're going to talk about the exercise. This is very, very important exercise. It's called SNAG. The full form is the Sustained Neutral Epiphyseal Glide. So what it does is, in this position, you hold the towel, one hand you pull it down. The pressure is down. The other hand, you turn the head. Don't try to pull it forward. You turn the head with the other hand, and then you're just trying to get the glide. Okay, so this is very, very important. Like, people with the stiffness, this really helps. Okay, so in the morning when you're getting stiff, or if you're working on the computer and you forgot that stretching that I explained, then you want to do this one. That will help you to improve your range as well. Immediately it will increase your range. Okay, let's do the next. Okay, Superman pose. That really helps your back and upper back, both. Okay, so you lay down on your stomach on the bed, and then you're gonna lift your hands and back and try to hold for about 10 seconds and then relax. Okay, about 4 or 5 repetitions is good. Let's do the next one. All right, so this one is very basic exercise. Does not matter what condition, but this one is very helpful to strengthen your neck muscle. This is called the isometric exercise. What it means, the iso means same. The isometric. Metric means like same length. You're not changing the length of the muscle. Okay, so you're just pushing against your hand, or when you lay down, you can do it in the laying position. You push on the pillow. You can go on your back, push it back. Go on your stomach, push it forward. Go on your side, push on each side. Hold for 10 seconds. Do about 5 repetitions. That will really strengthen all the neck muscles. Okay. All right. Let's do the next. Wall angel, YWLT. So this one is like you stand against the wall, okay, and you're gonna go all the way up. So basically, this is Y, okay, this is W, okay, this is L, okay, and the T down as well, okay. So YWLT, this is really helps you to improve your all the shoulder girdle, your upper back muscles that really strengthen. So this exercise is also very helpful. Okay, let's do the next. All right, summary. This is the last slide. So basically, posture improves with the appropriate stretching and proper exercise. You have to be consistent. If you just do one time, it's not going to help. If I want to build up the biceps, if I take a dumbbell, do one time, then do maybe after 2 weeks, and after a month, I say I don't see any like shape. I don't know why. I did the exercise. No, you had to condition your muscles. So it has to be very consistent to work on your neck. Okay, lifestyle changes, your habits, very important that you make some changes in your lifestyle. Okay, that will go long. Text neck affects many people, especially in this era where we use the smartphone, computer all the time. You want to make sure you think about that in daily basis. All this screen time app, or like 2020 21 app, as I mentioned, is you're already using it. use the wisely. So that can really help you with that. Radiating pain, tingling, many times, like, that people said, oh, I got a tingling, numbness, do I have to go with the surgery? Not necessarily. Means like you can try the conservative way first. There is a way we can, like, with the decompression, with the strengthening exercise, it can be relieved. And then we can discuss, like, if it doesn't go, if the situation is worse, we can do some more special tests to find out, like, what kind of damage you have. And if that doesn't work, then we can think about it. But definitely we can avoid tingling, numbness, radiating pain doesn't mean surgery at the first. You wanted to try the conservative way first. Okay. All right. Thank you so much. This is all. I try to keep it very simple and trying to address all the topics of daily need. And then we can start with the question and answer if someone has.
Our first question is, are back pain and neck pain related? Because I have both lower back and neck pain.
So the answer is yes and no. Means like it can be related, but it can be like, so because you have a neck pain, you will get a back pain. No, that's not right. Or if you have a back pain, then you were going to get a neck pain. No, that's not right too. But if you have some bad habit, the posture, bad posture, you're not doing regular exercise, or you're not addressing those things, then it can lead to back pain and neck pain. But it's not like, related. It's not like if you have a back pain, you will get a neck pain, or if you have a neck pain, you will get a back pain. No.
Okay, thank you. The other question is, what if we don't use any pillow?
That's fine. I don't use pillow, but that depend on your mattress, because I have a memory foam. Okay, so my memory foam is a way that when I lay down, my body goes down and my neck is supported. So when you lay down, you have to understand what you can do. My tip is that when you lay down on the bed, have someone take a photo from the side. Okay, so when you take a photo, look at the position. You saw the slide and how the head and body was aligned. So look like, if your head is going back too much or up too much. So when you take a photo, and that you can then compare it, like you can see, oh, now I'm going up. That means, yeah, that's like, definitely higher. Or if you're going a little bit extended, that means you need a pillow. Because so based on that, you can decide. But yeah, you don't necessarily have to use the pillow. But again, as I said, it depends on your mattress. It depends on your habit.
The next question is popping the neck advisable?
Many times people do pop. The popping means like, you're releasing the gas between the disc. Okay. So there is no problem with that one. But after some times, when you keep on popping all the time, you won't see any, like, initially what happened when you pop it, oh yeah, it feels good. But after it becomes a habit, you won't feel any difference. You will just like, popping. But there is no problem, like there is no adverse effect on cervical spine, like, not on the vertebral, like, the quality. So that's okay, but it's not advisable to do it all the time.
Okay, the next question is, we sometimes deal with neck pain due to bad sleeping posture. So, can you comment on sleep posture do's and don'ts?
Yes, so the do's and don'ts is very important. When you sleep, you keep the pillow. If you're a back sleeper, you have to keep the pillow under the knee. Why? Because when you bend your knee has to be bent enough that your lumbar is flat on the bed, so it's resting. Okay, so it's in neutral position. If you're a side sleeper, you want to keep the pillow between the legs. Why? Because when you don't have a pillow and if you go on your sideline, you're crossing your leg a little bit like this way. When you cross your leg, your spine is going this way too. So when you stay in that position for a long time, in the morning you are gonna get a pain. One side is pulled and the other side is not. In the neck, you want to make sure that, as I said, the pillow, as I was explaining in the slide, that right pillow is very important. Um, what I do is when I sleep on the back, I don't use pillow, as I explained earlier. If I go on my sideline, because there are many times people sleep like half a night, they sleep on the back and then they toss and turn. They go on the side. So if I'm turning, I use the pillow. So it become a habit now. Okay, so I'm sleeping flat on the back, no problem. I'll sleep like, without pillow. But if I'm going on the side, then I'll put the pillow, because if I go on your side, I need to fill that gap. Okay, so those are the things that you wanted to make sure you follow.
Okay. The next question is, can we tell if any of these symptoms of neck, back pain relate to sciatic pain or issue?
Yes, the sciatic is the name of the nerve. Okay, so that originates from L4 L5. So basically, from the lumbar, that nerve goes down. So in the one of the slide, I show you that photo where the disc was bulging out and it was compressing the nerve. The yellow kind of a rope that you were seeing was the nerve. Okay, so sciatic pain. Whenever say that I got a sciatica, what it means, sciatica means it's inflammation of the sciatic nerve. Whenever you're compressing your spine, whenever you're bulging, this happen, it compress on your sciatic nerve, or if your that particular level is affected, that compress your sciatic nerve, and because of that compression, you start getting the symptoms down to your leg, because sciatic nerve is the longest, like, it's a long nerve that goes in your leg. It goes all the way down in your feet. Okay, so back pain and neck pain, it can radiate. So that's the product of your back pain. The sciatic pain is a product of your back pain. So something is wrong with your spine that lead to that symptom. Same with the arms, because if you have a problem with the spine, that does radiate down to your shoulder. Okay, or the arm. So as I mentioned, the based on the symptoms where you're getting numbness, tingling, based on that, we can tell what level of the spine is affected.
Okay. How will I know if I have, sorry, can taking massage in spas or parlors may have negative side effects on our neck or shoulders?
Okay, so ma- massage is good actually, because the massage is more maintenance. Okay, so what you do is every day in daily life, you're working, you're like, at the job, your muscles are tense. So the massage therapist, if it's a good massage therapist, they're gonna work on your muscle, they're gonna look at the muscle fiber direction, they're gonna look for the trigger points and trying to help you with that one. But that is just the maintenance. They're gonna relax your muscles, they're gonna relax you, nothing else. They're not going to cure any condition, but at least once the massage is done, you're going to feel relaxed. Okay, so your muscles will be relaxed. So in the long run, it's good to have a massage as a maintenance, but not as a treatment, because many times people get the neck pain and they go to the massage, get massage, they feel good. Again, after a week, they said, okay, I got the same pain, so I'm going to go to the massage and take care of it. That's not good. If you keep on getting the pain, then you wanted to address that. You don't want to just get a massage and just take care of it. You wanted to make sure that you do something about it, not only just massage. But if you don't have a massage, you just have a strainful job, go for a massage, get relaxed, like, on your massage. Many times, the surgeon who does the surgery, like orthopedic doctors, many times after the surgery, they directly go for the massage, because 6 7 hours, if you're there working, like looking down and working on all the surgery, they get stressed. Okay, so after that, they relax the muscles. So they don't have a neck pain or anything at that time, but they're just doing the maintenance. Okay.
Thank you. The next question is, how will I know if I have inflammation or muscle spasm for hot and cold packs?
So the muscle spasm is the tightening of the muscle. So right in the spine, right in the center. Okay, so if you have any pain, the pain which limits your range in your spine, it really, like, feel a little bit swelling around the spine, that's the inflammation. Okay, the muscle spasm is, if you look at the muscle, if you touch it like this, if you feel it, you're gonna feel tight rod. Now, in the therapy, like, we do this every day. So when I'm doing the palpitation on the patient, immediately we can tell that, okay, which muscle is tight and which is not. But in your normal cases, if you don't know what is spasm in normal cases, you can just feel like, if you push it, try to push on both sides. Okay, one side you will feel a little more tight than the other, that's a spasm. Okay, so those is a spasm, but the inflammation, you're gonna feel tenderness. Okay, so on your spine, if you're just touching down there, you're gonna feel the tenderness. Also, one of the most important thing with the inflammation is that you get the like pain. If you're feeling the pain, radiating pain, if your pain is coming down to the shoulders or arms, that is definitely inflamed spine.
The next question is, can pain increase if same muscles are overused?
Yes, yes. Like if you use, and that's exactly I meant in the slide, that repeated movement. If you're using the same muscle over and over in improper way, then it does affect. If you know that, like it's called conditioning. So if someone know, like many times the sports injury, or people who play sports or some occupation require that kind of work, we call conditioning. So what it means is that we work that muscle, we strengthen that muscle, we make that muscle ready for that movement, then it's okay. But if your muscle is not ready, and if you start using that muscle over and over, that's gonna cause a problem. Because what will happen, let's say your one side, our body is more synchronized, it's balanced. If your one side is using a lot, that means that side will pull. Okay, so whenever that pull happen, the other side will become weak, and the side that you're using will pull your whole spine. Okay, and that will cause the imbalance between the body. So that can cause a problem. But if you know for sure that okay, you're doing certain works over and over, then you can definitely strengthen that particular muscle, and then that should be okay.
What precautions can we take while cooking? At times, the cooking hours get prolonged.
Yeah, so the cooking, you want to make sure, like okay, so we cannot change the height of the stove, because you got to look down or something. But at least the prep work, you can make some changes for that. Okay. So when you're doing some prep work, I would suggest to sit down, make sure like, you're sitting on the table and like in a proper height, and you can do it. If something heavy work you want to do it, then you wanted to make sure you do it right way. Okay. Okay, one of the tip that I can give is any work, any cooking or anything, like you're doing heavy work, you don't want to keep the like things away. You want to base a little bit close to that, so that way you can have a good support. Okay, because many times if you're lifting something and if you're like far, you're adding the weight. Okay, so if you're doing the cooking and if you're chopping with like far hands like that, that's not good. You want to keep it a little bit close. Okay, and let's say you're cooking for 1 or 2 hours, for example. Okay, so 2 hours you had to be standing position cooking for all the guests and everything. So same rule apply for the computer users. You want it to stretch your muscles every 15-20 minutes. If you know that you're going to be standing there for 2 hours, okay, you want to make sure like 15-20 minutes, take 20-second break. Okay, just 20-30 second, and just like move your neck side to side. Okay, just like move your shoulders, and that will really help you. Believe me, these small tips can really help you to avoid the pain or stiffness in your neck.
Okay. The next question is, I always sprain my back when I lift heavy things the wrong way. Please suggest the best posture, or do I have to avoid it due to back pain many times?
So let's say I'll talk about two things. If you have a pain and if you don't have a pain. If you have a pain, definitely avoid it. If you have a pain, that means like your pain is active. It means like there is possibility that you have inflammation. And if there is inflammation, so to understand the inflammation is the swelling. Okay, so the one of the symptoms of the inflammation is swelling. So in your disc, it swells up, that compress your spine, that compress your nerve, and you get more symptoms. So if you have an active pain, and if you're trying to lift something, it's gonna make it worse. When you have a pain, you don't want to lift it at that time. Okay, but if you don't have a pain and if you have to lift it, the lifting technique, last time I did the presentation on back pain, so I did go over like it's a lifting technique, but I'll gonna still kind of explain right now. So what you need to do is, one, use your legs and knee. Okay, don't use your back. Okay, so if you can see it not. Okay, so you won't be able to see it, but basically what you want to do is that bend your knee, bend your hip. Okay, keep your back straight, keep your weight, your whatever you're lifting, close to the body. Okay, so whenever you do that, you're making sure you're avoiding the strain on your back. Another important thing, tight your abdominal muscles. Okay, so whenever you're doing lifting, you have to tight your abdominal muscles, because your abdominal muscles will brace your spine. Because the purpose of the tightening the abdominal muscles, it will hold the spine. Okay, so when you hold the spine is secure. And then instead of using the back muscle, don't lean to use the back muscles. Use your knee and hip, bend that one, and then trying to lift it up. Okay, another thing is breathing in and out. When you're trying to lift something, you breathe out. Okay, so any exertion you're doing, you're breathing out. Okay, and if you look in that in the back presentation, there is a whole pictures and videos that how exactly you wanted to do it. And if I see if you want information, I can try to, in the comment section, I can try to write down about that too. I can try to upload the photos as well. Okay.
Thank you. The other question is, can the wrong type of pillow cause neck pain? Which ones should we use and what should we avoid?
Right. So yes, wrong pillow can cause a back pain, because that's what I explained. That custom pillow is very important. Or if you get a pillow from the market, you got to make sure it's appropriate, because your cervical spine, lordosis, as I explained in the earlier slide, that curvature has to be maintained. Okay, so in the spine, in the cervical spine, we have that little bit curvature. Okay, so when you use the pillow, there are pillows where it's flat and then a little curve. That kind of pillow is good, because no, our neck is not flat, because we have a backside of the head, then there is a neck, and then there is a whole back. Right, so that kind of a slide, the curve that we have, that need to be filled. So it's very important that you get the right pillow. To get the right pillow, as I said, in there, one company that I know that we do it, it's called Pillowise. Okay, Pillowise, WISE. You can go on the website, and they have lots of locations, and you can only get it at the clinic. You don't get it in the store. No Amazon, no Walmart. The reason is because you go to that near clinic, whatever you have, they will measure you. Okay, so when we at our clinic also, we do that one. So what we do is we measure from shoulder tip to shoulder tip, so we know exactly how width of your shoulder. We measure from your mustard process, from here to here, that what is this length of from here to here. Okay, we ask the questionnaire, we measure the circumferences of the neck. We ask the question, what kind of habit you have. Are you back sleeper, side sleeper? What kind of mattress you use? Is it soft mattress, firm mattress? Based on that, the material, the size is differs. Okay, so it's very important that you get that. If you don't want to do that, you can get the ready-made pillow from the market, but you want to make sure you have a right height. So as I mentioned to the other person, when you lay down, take a photo from the side. Okay, ask someone to take a photo from the side. What you are looking for is the straight posture. Your neck should not be lifted, or your neck should not be extended. It has to be neutral. As long as your neck is neutral, you're good. Okay.
Thank you. The next question is, with virtual learning, children are spending more time in front of the computer these days. So, what preventative measures would you suggest for them to avoid neck pain?
Yes. So the most important thing is the height, because I know that many times what we do, that we don't have a time. So whatever the chair we have, we just say, okay, let's just sit in that one. And that does affect, because what happened when they sit down, sometimes the chair is too low. Okay, and the computer is high, and then trying to their hands is all the way up. Okay, so either you get their chair, the small chair, and they create the whole workstation for them, because you know that they're going to spend a long time with the virtual class, because right now there is no certainty. They're going to use even my daughter, I have a 6-year-old, she's doing the class regularly online. She's not going to the school right now, doing all the virtual. So we're making sure that we assign her a station. We're making sure the chair height is proper. If it's not height proper, you can put the pillow to increase the height. Okay, put the stool or something on the bottom, so their feet is not hanging. Because what happened, they just the leg is just hanging. That does cause the strain on the back as well. The computer or iPad, something has to be a little bit far. Don't keep them too close. It has to be a little bit far, and the eye at the eye level. Okay, so those of the modification is very important that you create. But the best thing, because if it's a small kid like my daughter, 5-6 years, they won't know. So basically, we have to literally create their own environment. And if it's an older kid, like 12-year, 15-year-old, then you wanted to make sure you explain it to them, okay, these are the things we're looking for. Make sure your back is supported, make sure you don't your leg is not hanging, make sure your height of the laptop or distance is properly maintained. Okay, so a little bit of education is needed for the kids too.
Great. Thank you, Dr. Vyas. With that, we come to an end of our health webinar today. On behalf of Radha Krishna Temple, I would like to express our appreciation to Dr. Vyas for an insightful presentation on the causes, symptoms, and treatment of neck pain. I'm sure our viewers found it beneficial. I would also like to express our gratitude to Dr. Khandelwal, without whose initiative and effort this program would not be possible. Thank you all for joining us today, and I hope to see you all again in our next webinar. Thank you.
Pleasure to be on the show. Thank you.